Can AI detect cancer before doctors? The future of cancer diagnosis. Cancer diagnosis is entering a new era, and artificial intelligence is one of the biggest reasons why. For years, doctors have relied on scans, biopsies, blood tests, and pathology reports to find cancer. Those tools are still essential. But now AI is being trained to look deeper, faster, and in some cases, earlier than the human eye alone. That raises a powerful question. Can AI actually detect cancer before doctors do? The short answer is, sometimes, AI can spot patterns that are easy for humans to miss. But the full answer is more interesting, and more important. AI is not a magic machine that suddenly knows everything about cancer. It does not replace doctors. It does not make perfect decisions. What it can do is analyze enormous amounts of medical data and detect subtle warning signs hidden inside that data. And that matters because cancer is often easiest to treat when it is found early. In many cases, the earliest signs of cancer are extremely small: a tiny irregular shape on a mammogram, a suspicious cluster of cells on a pathology slide, a faint pattern on a CT scan, a skin lesion that looks almost normal, or even a molecular signal in blood that doesn't look alarming at first glance. To a busy human reader, those changes may be difficult to notice, especially when they are rare, subtle, or buried inside thousands of normal details. AI is designed for that kind of pattern recognition. These systems are trained on huge numbers of medical images or data samples. They learn what normal usually looks like, what suspicious changes look like, and how certain cancers may appear in their very earliest stages. Over time, the software becomes good at flagging areas that deserve closer attention. One of the best-known examples is breast cancer screening. Researchers have developed AI tools that analyze mammograms and highlight suspicious regions. In some studies, these systems have helped identify cancers that radiologists might otherwise detect later or with less confidence. That doesn't mean AI is replacing radiologists. It means AI can work like a second pair of highly trained eyes. The same idea is expanding into lung cancer, colon cancer, prostate cancer, skin cancer, and many other fields. In lung cancer, AI can examine CT scans and look for tiny nodules or changes in shape, texture, and growth pattern. In skin cancer, AI can analyze images of moles and lesions and compare them with huge databases of known examples. In pathology, AI can scan digital tissue slides and identify abnormal cells, grading patterns, and tumor features with extraordinary consistency. And one of the most exciting areas is blood-based detection. Some researchers are building AI systems that analyze blood signals, like fragments of tumor DNA, proteins, or other biomarkers, to help identify cancer-related patterns. The goal is to move toward earlier detection, possibly even before symptoms appear. That sounds incredible, but this is where we need balance. AI is powerful, but it is not perfect. A model can only be as good as the data it was trained on. If the training data is incomplete, biased, low quality, or unrepresentative, the results can be misleading. AI may produce false positives, flagging something suspicious that turns out not to be cancer. It may also produce false negatives, missing a cancer that is actually there. And in medicine, both mistakes matter. A false positive can create fear, more testing, and unnecessary procedures. A false negative can delay diagnosis and treatment. That is why AI in cancer diagnosis is usually being developed as a support tool, not a replacement for clinical judgment. The safest and most realistic model is human plus AI, not human versus AI. Doctors bring context that machines do not fully understand. They know the patient's symptoms, history, risk factors, family background, and clinical picture. AI may find the pattern, but doctors decide what it means and what to do next. Another important challenge is trust. If an AI system says something looks dangerous, doctors need to know why. A black box answer is not enough. That is why explainable AI is becoming such an important field. Many systems are now designed to highlight the exact area, pattern, or biomarker that triggered concern, making the result easier to review and verify. There is also a major difference between research success and real-world use. A system may perform beautifully in a laboratory or on a curated dataset, but hospitals are messy, real environments. Image quality varies, equipment differs, populations differ, workflows differ. Before AI becomes routine, it has to prove that it works reliably in everyday clinical practice. Even so, the direction is clear. The future of cancer diagnosis will likely include AI-assisted imaging, AI-assisted pathology, smarter blood tests, and integrated systems that combine scans, biomarkers, genetics, and patient history. Instead of relying on one clue, future systems may connect many clues at once. That could mean faster diagnosis. It could mean finding dangerous cancers earlier. It could mean better screening strategies for high-risk patients. And it could mean helping doctors focus their time and expertise where it matters most. So, can AI detect cancer before doctors? In some situations, it may detect suspicious patterns earlier than a human observer working alone. But the real breakthrough is not AI replacing doctors. The real breakthrough is AI helping doctors see more, see sooner, and make better decisions. That is the future of cancer diagnosis. Not machine instead of medicine, but smarter medicine, powered by both human expertise and artificial intelligence. And if that future continues to develop responsibly, it could change the story of cancer detection for millions of people.